Okay. Hi, my name's Andrea. I'm a student nurse at UNLV. I'm here to give your head to toe assessment. Can I have you verify your name and date of birth?
Dylan Anderson, 08-2603.
Okay, great. So I'm just going to start by asking you some questions. Have you had any recent fever, chills, weight loss, or weight gain?
No.
Any recent headaches, dizziness, or head injuries?
No.
Any ear pain, ringing of the ears, or ear infection?
No.
Any eye pain, difficulty seeing, or discharge?
No.
Any sinus pain or allergies?
No.
Any mouth pain or bleeding of the gums or toothaches?
No.
Any throat pain, swollen lymph nodes, limitation of motion of the neck?
No.
Any shortness of breath, wheezing or coughing?
No.
Any tightness of the chest or high blood pressure?
No.
Any recent swelling or tingling of the arms and legs?
No.
Any recent loss of appetite or food intolerances?
No.
Any recent frequent urinating or difficulty urinating?
No.
Any recent stiffness of the joints or limitation of motion of the arms or legs?
No.
Okay, any recent dizziness or fainting or blackouts?
No.
Okay, and any recent excessive bruising or frequent bleeding?
No.
Okay, great. So I'm just going to start by asking you your name and date of birth for our physical part of the assessment.
Dylan Anderson, 08-2603.
Okay, and can you tell me where we're at
We're at North Las Vegas
and why we're here
for a physical.
and today's date?
Today's date is 22nd of the February,
Okay.
2021.
All right, so patient is alert and oriented ×4. Patient is calm and cooperative. Patient appears well groomed. Patient appears stated age. Patient's speech is clear and concise. And patient's skin color is reflective to that of ethnicity. Okay, moving on, I'm going to take a look at your face. So I'll have you remove your mask. Okay. Patient is calm and cooperative. Face is symmetric. Cranial nerve 7 is intact. Skin is pink and perfused. I see no swelling, drainage, or bruising anywhere. And I'm going to feel your jaw joint just open and close. Okay, patient's TMJ is intact, smooth, clear of popping or cracking. Cranial nerve 5 is intact. Now I'm going to take a look at your neck. Okay, patient's neck is symmetric and supple. I see no lesions, skin is intact, pink and perfused. And now I'm going to feel your trachea. Okay, patient's trachea is midline. I'm going to feel your carotid pulse. Both sides. Okay, patient's carotid pulse was present at grade 2 bilaterally. Now I'm going to take a look at your ears. Okay, patient's external ear structure is pink and perfused. Skin is intact. I see no bruising or swelling or any drainage bilaterally. Next, I'm going to test your hearing. So I'll have you cover one ear and then just repeat to me the whispered word I say, okay?
Cupcake.
Okay, now we're going to do the same thing with your other ear.
Banana.
Okay, so patient was able to identify a whispered word from a 2 feet distance. So hearing is equal to that of examiner and cranial nerve 8 is intact. Moving on, I'm going to take a look at your eyes. So look at me. Okay, patient's external eye structure is pink and perfused. I see no drainage or swelling bilaterally. And now can I have you pull down your bottom eyelids? Okay, patient's conjunctiva is pink and moist. Sclera is white and moist. And cornea is clear and moist. Irises were brown bilaterally. And now I'm going to shine this light in your eye. So I'm going to take a look. And now look at my pen. I'm going to bring it closer and follow the pen. Okay, patient's eyes are equal and round, reactive to light and accommodating, both direct and consensual. Cranial nerves 3, 4, and 6 are intact. And I'm going to take a look at your mouth. So patient's lips are pink and perfused. I see no lesions or swelling. Now I'm going to have you open and say ah. Okay, patient's mouth was pink and moist. Buccal mucosa was pink and moist. Gums were pink and moist. Tongue was pink and moist. There were no lesions or swelling or bleeding in any of the areas. Dentition is intact. Tongue and uvula were midline, and uvula rose midline upon phonation of ah. So cranial nerves 9 and 10 are intact. Patient's tonsils were present, grade 1, and the floor and palate of the patient were pink and moist, free of lesions, and no bruising was present. Okay, so now I'm going to take a look at your back, so I'm going to have you face that way. Okay, so you're fine, I'll remove it. So patient's thoracic cage is elliptical, shoulders are symmetric, cranial nerve 11 is intact, the skin is pink and perfused, I see no lesions or swelling or any drainage anywhere. I'm going to feel for any lumps. Let me know if you feel any pain, okay? Any pain?
No.
Okay, so no lumps or tenderness were noted upon palpation. So now I'm going to percuss for any signs of dullness in the thoracic cage. So okay, so patient displayed resonance upon percussion, no dual notes were heard. So now I'm going to listen for breath sounds, so you could just breathe normally. And I'll have you face a little bit more that way if you could. There you go. Alright, patient's breath sounds were clear and smooth, free of adventitious sounds such as wheezing or crackling bilaterally. And okay, so we're all done with your back, so now I'm going to have you come back over here and I'm going to take a look at the front of your chest. Just sit down. Okay, and I'm going to drape this down just a little bit. Okay, so patient's anterior chest is pink and perfused, skin is intact, I see no lumps or visible pulsations. I'm going to feel for any lumps. Let me know if you feel any tenderness, okay? Any tenderness?
No.
Okay, so no lumps or tenderness were noted upon palpation, and patient's respirations are eupnic. So now I'm going to test for voice sounds. So every time I put my hand down, say the word 99, okay?
99. 99. 99.
One more time.
99.
Okay, so tactile fremitus was equal bilaterally. And now I'm going to listen for breath sounds again in the anterior chest. So you can just breathe normally. And pull this down just a little bit more. Okay, patient's breath sounds were clear and smooth, free of adventitious sounds such as wheezing or crackling. So now I'm going to take a look at the heart chest area. I see no visible pulsations or heaves. The skin is intact, pink and perfused. I see no swelling or redness. And now I'm going to listen for your heart rate and rhythm. So just breathe normally again. Okay, patient's apical pulse was 85 and the rhythm was regular. So now I'm going to listen for your heart sounds in 5 different areas. So I'm going to use my belt and my diaphragm, so just breathe normally. Okay, now I'm going to switch. Okay, S1 and S2 were heard upon auscultation with my belt and my diaphragm and my stethoscope. No S3 or S4 were heard, and no heart murmurs were heard with my belt side of my stethoscope. Okay, so I'm going to lift this back up. Now I'm going to have you lay down. Okay, and I'm going to take a look at your abdomen, so I'm going to lift this up. Okay. Patient's abdomen is flat and symmetric. The skin is intact. I see no visible pulsations. No lesions or redness are present, and umbilicus is midline. So now I'm going to listen for vowel sounds. Okay, patient's vowel sounds were present, and now I'm going to listen for any bruits in the aorta with my bell side of the stethoscope. Okay, no bruits were heard upon auscultation with my bell side of the stethoscope. Now I'm going to do some light palpation to feel for any lumps or masses. Let me know if you have any pain. Was there any pain?
No.
Okay, so no lumps or masses were noted upon palpation of the abdomen, and no tenderness was noted. Now I'm going to do a deep palpation, so Maddie, take a deep breath, and I'm going to... Okay, so no organomegaly was noted upon deep palpation of the abdomen. Alright, so we're all done here. Next I'm going to test your range of motion and muscle strength of your lower extremities. So first I'm going to have you with your right leg lift up, back down, to the side, back in, bend your knee, and go in a circle. Now we're going to do the same thing with the other leg. Go up, back down, back out, in, bend your knee, and in a circle. Okay, now I'm going to test your muscle strength. So go up with this leg. Okay, back down, towards me, and back in. Same thing with this leg. Go up, back down, out there, and back towards me. Okay, so patient's hips displayed a full active range of motion. Muscle strength was equal bilaterally. And I'm going to take a look at the skin of the lower extremities. The lower extremities are symmetric. Patient's skin is warm to touch. Skin is pink and perfused. I see no swelling, redness, or any lumps anywhere. Hair distribution is even bilaterally. And now I'm going to feel for his post-tibial pulse. Okay, so patient's post-tibial pulse was present bilaterally, grade 2, and I'm going to feel for dorsalis pedis pulse. Okay, patient's dorsalis pedis pulse was present bilaterally, grade 2. Right, so I'm going to feel one more time. Okay, and no pretibial edema is noted bilaterally. Okay, now we're going to pull this back down. We're going to come back over here, and you can sit on the edge of the bed. Okay, now we're going to test range of motion of your knees and ankles. So with one leg, we'll have you go up, back down, and then with that ankle, go like this. Now with the other leg, kick out, back in, and with the ankle in a circle, and back up and down. Same thing with the other one, we forgot to go down and up. Okay, so patient's knees and ankles displayed a full active range of motion, and muscle strength of the knees and ankles was equal bilaterally. So now I'm going to test for foot pushes and strength. So with one foot, lift your foot up like this, and I'm going to have you push against my hand. So lift up, back down, over here, lift up, back down, and with the knee over here, lift up, back down, and then kick up, back down. Okay, so patient's knees displayed equal muscle strength bilaterally, and patient's ankles displayed equal muscle strength bilaterally, and foot pushes were equal bilaterally. Okay, so now we're going to do your upper extremities. You can stand up if you want to. So we're going to go forward, back down, to the side, back down, and then in a circle, and then in another circle backwards, and then shrug your shoulders. Okay, good. And now we'll do your elbows. So we'll go down, and then up, and then we'll do your wrists. So up, down, this, and then, okay, good. So patient's shoulders, elbows, and wrists displayed a full active range of motion. Now I'm going to test for muscle strength. So with this arm, go out. Okay, back in. Okay, and then come forward with your arm. down. Then we'll do the same thing over here. Come out, back down, and then forward, back down. And now we'll do your elbows. So we'll do this arm first. So go down, back up. Okay, elbow on this side, up, back down. And now we're gonna do your wrist. So go like this for me. Okay, push against my hand, and then up. Okay, good. So patient's shoulder, elbow, and wrist displayed equal muscle strength bilaterally. And I'm gonna test for hand grip. So grip my hands as hard as you can. Okay, good. Patient's hand grips were equal bilaterally. And you can take a seat. I'm gonna take a look at the skin of your upper extremities. Move this up. Both sides. And normally I would look all the way up to the shoulder. Patient's skin is pink and perfused bilaterally. I see no lesions or bruising bilaterally. Patient hair distribution is even and skin is warm to touch. I'm going to feel for brachial pulses. So, okay, patient's brachial pulses were present bilaterally, grade 2 bilaterally. And now I'm going to test for radial pulses. So I'm going to do this. Okay, patient's radial pulses were present, grade 2 bilaterally. And now I'm going to test for skin turgor bilaterally, one at a time. Okay, patient's skin turgor was brisk bilaterally. And now I'm going to take a look at your nails. Over here. Okay, patient's capillary refill was 1 to 2 seconds bilaterally. I'm going to take a look at your nails. Okay, patient's nails are pink and perfused, and I see no early signs of clubbing. So, moving on, next I'm going to do your neurological test. So, first I'm going to do a pain sensation test. So, I have this object, it has a sharpened dual end. I'll have you close your eyes and tell me if what I poke you with is sharp or dull, okay? Okay, close your eyes.
Dull.
Okay.
Sharp.
Okay.
Dull. Sharp. Sharp.
Okay.
Dull.
Okay, so patient was able to distinguish between sharp and dull. So pain sensation is intact bilaterally. Now I'm going to touch you with a Q-tip, and you let me know if you feel it. Just say yes, okay? I'm going to have you close your eyes as well.
Yes. 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 Yes.
Okay, so patient was able to identify a Q-tip upon light touch sensation bilaterally. So next I'm going to have you stand up. And I'm going to test your gait, so I'll have you walk that way, normal, just walk regularly. Okay, and now walk back to me from heel to toe. You can turn around and face me. And now walk heel to toe. Okay, now walk back on your tippy toes. And then on your heels back towards me. Okay, good. You can stand here for a minute. So patient's gait was steady and balanced. Patient displayed no swaying or falling over. So now I'm going to test for Romberg's test. I'm going to have you stand still for 10 seconds with your eyes closed. And normally I would do this for 30 seconds. So go ahead. Okay, good. Patient tested negative for Romberg's test. Patient did not sway and was able to stand straight. So lastly, I'm going to take a look at your spine. I'll have you face the wall. Okay, patient's spinous process is pink and perfused. I see no masses, swelling, or bruising, and I see no lesions. I'm going to feel for any lumps or masses. Let me know if there's any pain. Any pain?
No.
Okay, so no lumps or masses were present upon palpation, and no tenderness was noted. So now I'm going to have you bent over. I'm going to take a look at your spine. Okay, good. Come up. All right, patient's spine alignment was straight and symmetric, and no signs of scoliosis. Okay, you're good. We're all done. Thank you.